Hi everyone, and welcome to A&P with Dr. O. Next we have transitional epithelium. And transitional epithelium is a little bit unusual. And the reason why it's an unusual stratified epithelium is because the cells can change shape. Cells can change between squamous and cuboidal. And that's because we are going to see stretching of this tissue. This tissue is going to be found in places like the urinary bladder, the ureters, the renal pelvis. If we think about the urinary bladder, it needs to stretch and expand as it fills with urine to temporarily hold it. And that's why it's important for this tissue to be able to transition. Again, it's an unusual stratified epithelium because we can change shape between squamous and cuboidal, and it also tolerates repeated cycles of stretching without damage. And I think, the cells, it almost looks kind of like ice cream cones because you can kind of have these cube cells and these more squamous shaped cells. And you can get this kind of ice cream cone effect going on with the cells here. That is one analogy sometimes that people will use. And that's something that you can think about when you're trying to identify transitional epithelium. If we, again, are trying to find this epithelium underneath the microscope, we want to look for the apical surface, which again is the space or the free surface. So we can see that here and here as well. And that means that this then is going to be our epithelium. And what I've done is I've given us a view that's not as enlarged. That way we can really kind of take it in. And then I've blown up so we can really zoom in on that epithelial layer. We know that where the epithelium connects down to this next layer, this connective tissue layer, that's going to be our basal layer there. That's going to be our basal portion. And I'm going to make this line just a little bit nicer for us there. That way we can really see the basal side, again, before we get to that connective tissue. And this is going to allow us then to find and label the basement membrane. It's going to be opposite of that apical surface, and it's going to be where the epithelial tissue is going to be binding to that connective tissue. Again, to find cells, it always helps to locate a nucleus. We can see one there pretty easily. We've got one here as well. And all of this tissue here that we can see that faces the apical surface. So all of this is going to be that transitional epithelium. Again, if I bracket out just this portion here, then this is going to be that transitional epithelium as well. Just zoomed in so that we can see it a little bit better. Again, found in the urinary bladder, ureters, renal pelvis, and it functions to permit expansion and recoil after stretching.